What happens when a fitness enthusiast develops spinal pain but refuses to quit training? Today's patient has a history of a compression fracture, thoracic discomfort, and low back tension from heavy deadlifts. In this session, we break down exactly what's going wrong and show how proper manual therapy can reset the spine, relieve pressure, and get her back on track. If you've ever felt tightness, stiffness, or imbalance during workouts, this one's for you. Today, we're working with a patient named Svetlana. She came in with complaints of mid-back pain, particularly in the thoracic spine. She's physically active and has a history of a compression fracture. Her goal is clear: stay in sports while addressing the pain. She also experiences lower back discomfort, likely due to deadlifts performed with inadequate muscular support. This kind of imbalance is common in athletes who focus on strength but neglect recovery and mobility. During assessment, I immediately noticed increased muscular tone, especially on the left side. Her posture shows signs of compensation, likely from habits like always carrying a bag on the same shoulder. From the side view, there's hyperlordosis in the lumbar region and a visible pelvic rotation to the left. We also saw asymmetry during a forward bend. One arm extended lower than the other, which rebalanced upon standing. These are all signs of functional imbalances we can work with. We proceeded with a warm-up massage. Palpation revealed tight areas, especially on the left. This kind of muscle tension is typical in fitness enthusiasts who train regularly but skip proper stretching. Over time, muscles shorten and posture changes, similar to what we see in bodybuilders. There are indications of a left-sided scoliosis. The curvature is subtle, but evident in the way muscle mass is distributed. The scapulae also protrude slightly, suggesting weakness in the rhomboid muscles, something we'll address through targeted work. We performed light stretching, focusing on the paravertebral and quadratus lumborum muscles. The tissue quality is good, elastic and responsive. As we progressed, we confirmed an overall imbalance. One side requires more effort to mobilize, while the opposite side is undercompensating. Neck and shoulder mobility tests came next. With proper support and controlled motion, we did passive rotations to assess and unlock restricted vertebrae. Her body responded well. No trauma history, which helps. For lumbar release, we moved into controlled rotation techniques. Adjustments were done with care, maintaining alignment and support. Postural instructions were also reinforced, for example, always getting up through the side, not straight forward, especially for those with spinal issues. continued with thoracic extension stretches. She has good flexibility, which allowed for deeper mobilization. Then, cervical mobility was reassessed. A blocked vertebra was visible through asymmetrical chin drop. We addressed this with manual techniques. Finally, we performed spinal decompression. A weighted setup was applied to facilitate release in the lumbar spine. We also assessed hip joints. Women often show joint locking due to pelvic structure, but in her case, mobility was excellent. Natural flexibility is a great asset, worth preserving long-term. After decompression, we finished with prone extensions, an important step to stabilize the spine and maintain the gains from the session. She stood up feeling lighter and freer in movement. One final posture check showed visible improvement, slight correction in muscle symmetry and alignment. She mentioned being surprised by how much her back cracked. That's a common reaction when locked segments finally release. We ended with advice. Avoid heavy deadlifts for now. There are safer alternatives that strengthen the same muscle groups. We'll cover those in an upcoming video on therapeutic exercise and spinal recovery. Thanks for watching. If you found this helpful, feel free to like, comment, and subscribe. And big thanks to Svetlana. She was a fantastic patient. Stay healthy, and see you in the next session.